Two small points with perhaps a call for comment. I receive Somatuline on a 28 daily basis, like probably a lot of people. This is administered by my partner after a period of training with a nurse, and all that is working very well. However, my first reflex was to call on a community nurse, and she refused to intervene point blank, said she didn't know what it was, had never heard of it, and pretty much wouldn't have anything to do with it. And so one big problem seems to be that there isn't any defined content for community nurses' intervention. Basically, they seem to do what they are prepared to do. Point two, my oncologist likes to have 2 scans of my tumor per annum to see whether it's getting bigger or smaller. Seems reasonable. When we got to the second scan, I received a letter from the insurer providing my health cover, saying that I was entitled to 1 free cancer scan per annum, and would I kindly send €293 by return of post. And I wondered whether there was a frequent problem in getting a twice yearly scan financed by health providers. Thank you.
So just to your first question about the district nurses, the community nurses, I've had patients call me who have said that the district nurses or community nurses, that it's not within their remit to come to the patient's houses and give that injection. I think the reason is because all the GP practices, there's a nurse practitioner now in all those GP practices, and they're the ones to give the injection. Also, the pharmaceutical companies will send out a nurse to your home, like you said, your partner gives it to you there at home. So I think that is why it's not part of the community nurses, as far as I know. And I forget what, sorry, your second point was. Oh, the insurance. Yeah, I'm not 100, because we work in a public hospital, I don't know a whole lot about the insurance, but what I do know is that in Vincent's private hospital, the MRIs, you have to pay €490 upfront, as far as I know, for your MRI, with a lot of the insurance with VHI, Viva, all those. So a lot of patients are now, who want a private scan, will go to different other hospitals, like the Beacon or the Hermitage or whoever, to get their scans done. But in the public hospital, there is, if you're getting your scans every 6 monthly, there's no problem with the MRIs and CTs. It's more if you need an urgent MRI, that's where the difficulty comes in.
It's a rare disease group still, and I do agree, and I think that the important thing is that there is a service, from nurses available from the companies that we can use. And I think going through the GP is probably a better way. If we try to educate district health nurses, it's too much, in fact, okay? So try to keep the expertise within the actual different groups. And if you're a new patient, the GP is not au fait or whatever like that, they can contact us as well, and we can get out. I call them the Novartis nurse or the Ipsen nurse to help out and train up the local people as well. That's possible to do that. But it would be impossible to diffuse all of this. I mean, a district health nurse might only see one patient, a year, or perhaps one patient in a lifetime sort of thing as well. So we have to sort of centralize, I would say, resources. Regard to the scan, and it's true that what Lisa mentioned, we use the private hospital in Vincent's because the public hospital is chock-a-block with one single MRI scan that takes a lot of time as well. So sometimes, in fact, if it's possible to get the scans done in a more urgent way and the insurance covers it, it is a problem though, and I know Jerome's going to comment on this as well.
It's a comment rather than a solution. I've been working here for 10 years now, and I still don't understand why some insurance companies will cover outpatient scans and some won't. What is obvious is that there's more competition now. The related point from the last questioner is that if an insurance company says clinically it's not covered, that has to be based on evidence. So what I have seen in the last year or two is the insurance companies, and this is the area of reimbursement for cancer drugs, once a HSE is funding a drug, then the private companies tend to follow. And I think I know some insurance companies have medical advisors, and they look at guideline documents. So if there's a suite of guidelines in use here or developed in Ireland that says these scans for this patient subgroup should be twice per year, then it would be remiss of an insurance company not to cover them.
Yeah, and it's something is again that maybe I'm not saying we should do this straight away, but it's something maybe that the patient group could work with maybe some of our radiologists in trying to push this along. This type of lobbying that goes on in the States quite a lot. In fact, this is what you're actually proactively doing now. I feel, you know, sometimes we send people to the I don't know, to not the Beacon, but there are a couple of other, the Hermitage or wherever. There's a lot of different private radiology group in the Dublin region now, and some of them will take them on. It is competitive. However, I prefer my scans to be done in my centre of excellence, because I know that the actual, you know, the injection times and the protocols are going to be verified and better. So it's something we should work at collectively again to try to ease that on a little bit, I think, Mark.
Well, actually, it's not really a question. It's just in regard to the gentleman was talking about the issues with the insurance company and scans. I just want to say from my own experience in terms of the private hospital, as long as your scan was defined or your condition was defined as an oncology condition, they allowed you to have the scan, and they actually paid the insurance company direct. The problem I ran into was that I wasn't referred by an oncologist for my scan. So, you know, that was the difficulty. So I had to pay up front because my condition wasn't defined as cancer, as an oncology. So that could be part of the problem. You know, and something that we might have to have a look at.
Whenever we order a scan within the NET group, there is a box that you tick to say if a patient is part of the NCCP group, you know, so they're a cancer patient. So that's the same as oncology. So, you know, I don't know whether that changes Carmel things or not, but it's certainly oncology is the same area as cancer.
Yeah, so again, just to say, I think it's something that we need to, that's why it's very important, but, you know, this is an issue. Unfortunately, in this country, for the moment, we do depend on private system to take up some of the diagnostic and therapeutics as well, and it is useful to us, and in our centre at the moment. I think it would be something that maybe us with the patient network group and through the committee we can actually try to articulate and work out, let's say, a better pathway. And if there's an extra box to tick, we'll bloody tick it. All right.